Well, good afternoon and welcome to GPA Live, the virtual education series brought to you by the Global Pain Association. I'm your host, Ron Aaron Eisenberg. Delighted to have you with us. We have a very special topic today. Literally millions of Americans struggle with fibromyalgia, and we're going to talk about living with fibromyalgia pain. Our special guest is Dr. Allison Polston. She's with the Practice Arthritis Associates. Before we introduce her, let's welcome the founder and executive director of the Global Pain Association, Dr. Susan Blackwood. Hey, Susan, we've missed you the last couple of weeks. Great to see you.
Here.
Well, we're
None of
delighted
us
to have
wanted to
you.
go through that weathering storm.
Yeah, but you've made it now, and we're so happy to see you. Talk to me a little bit about GPA, the Global Pain Association, and GPA Live.
Well, thanks, Ron, first of all, for moderating this and for the Eisenberg Group for producing this. It's just been a wonderful opportunity for us to reach people in the community that are suffering with chronic pain and their caregivers. We now have reached over 60,000 people that have watched either one of our segments or that are on our Facebook Live and go to our website. And we want to remind people that we've got a lot of resources that either they can watch on these Saturday viewings or they can go to our website. And we've got a way for people to register so that we can send them a weekly update on what will be the topic for that virtual series that week on the series, and other things that we can provide for them that could be resources. And we now this year started a support group, which is on the first and third Tuesdays of the month. It's being moderated by Dr. Pinkston. And I can't say enough about Marianne. She is a quality physician. She's such a good listener. And I think a lot of the people that have been on the support group have already really been able to gain a lot of information from her sessions. But we started a couple of years ago, and with the pandemic hitting, we went virtual, and we've been going since last May, and we've got a great volunteer board of directors and a great advisory council, and I can't thank them enough for all the support they've given. And of course, we can't do this without supporters, and so we'll talk about that a little bit later.
Well, Susan, thank you. And we're going to talk about a way you can win a Global Pain Association t-shirt and some HEB gift cards. All of that is coming up in just a little while. We're going to switch now to our topic for the day, brought to you by the Global Pain Association. We're going to talk about fibromyalgia. And if you are watching us on the GPA website, I encourage you to share this program so that we can extend our reach. It's easy to do. Just click share, and a whole lot of other folks can join us. And we really do encourage you to do that. Our guest today is Dr. Allison Polston. She's with Arthritis Associates. She has a doctorate degree in nursing practice from the University of Utah, graduated with honors. She's board certified as a family nurse practitioner and has extensive working experience in the chronic pain field. Dr. Polston is a member of the American Academy of Nurse Practitioners and the Texas Nurse Practitioners Association. Currently, she cares for patients living with autoimmune conditions and chronic pain. So let's welcome Dr. Allison Polston. And Dr. Polston, it is great to see you. Thanks for joining us. And let me start by asking, what is it that attracted you to work in the autoimmune and fibromyalgia field, dealing with folks who experience a lot of chronic pain?
So Ron, first of all, thank you for having me here. It is an honor to be with you today. And I wanted to let you know that fibromyalgia interests me because it's a very personal disorder. Patients that are affected by fibromyalgia have debilitating pain and fatigue, which leads them to question themselves and ask, well, why do I have so much pain? What am I doing wrong? Why am I not able to do things that I was able to do before, which leads to frustration, depression, and anxiety. So without the proper diagnosis and treatment, patients go through life without having the resources and support to manage their pain. So that's reason enough for me to just be excited to care about patients with fibromyalgia. To answer the second part of your question, my passion in working with rheumatology comes from having a very close family member diagnosed with autoimmune disorder. So I've witnessed firsthand how chronic pain, fatigue, frequent infections affect not only my family members' lives, but patients' lives. And yet, with all those conditions, patients put their best foot forward and they do their best to lead very meaningful and productive lives. So I just cannot think of a better way to spend my time and energy than caring for patients with autoimmune disorders and fibromyalgia.
Now, when we look at fibromyalgia, before we talk about the basics, how many people are said to have fibromyalgia?
So that's an excellent question, Ron. According to the CDC, fibromyalgia affects about 5 million Americans that we know of. Those are that are diagnosed. But we know that sometimes patients do not love the diagnosis of fibromyalgia because there's stigma attached to it. So we probably have a lot of patients still not diagnosed.
So 5 million could be 10 million.
Absolutely, could be.
And let's get back to the basics. What is it all about? When you look at fibromyalgia, what are we talking about?
Okay, so fibromyalgia is a disorder that is widespread. It's a muscle skeletal pain that is chronic, which means it lasts at least 3 months or longer. This is not inflammatory pain, and this is not autoimmune pain. So I have patients that say, okay, so I know that I have, for example, underlying conditions such as arthritis or lupus, and I have pain from those conditions. So why do I have fibromyalgia? Where is this pain coming from? What is causing it? So the cause of fibromyalgia is unclear, but we do know that symptoms come on after a traumatic event. It could be physical trauma, such as infections, an illness, maybe surgery or a car accident, or it could be also after psychological stress, such as abuse or post-traumatic stress disorders. So patients tend to ask, well, how is my body feeling the pain? I just don't understand it. The best way to explain it is that repeated nerve stimulation changes how the brain processes pain. So the brain has these pain receptors that sort of develop a memory for pain. And when the brain receptors pick up pain signals over and over again, they become sensitized to painful stimuli, such as cutting your finger, burning your hand, but they also become sensitized to non-painful stimuli, such as touching the skin or wearing glasses, things that should not usually hurt.
Now, is there a relationship between fibromyalgia and chronic fatigue syndrome?
Yes, absolutely. So fibromyalgia and chronic fatigue syndrome are not the same thing, but they both conditions have similar characteristics. Both have fatigue that does not get better with sleep. Both present with cognitive issues, which means hard to focus or concentrate. And also it's important to know that between 60 to 70% of patients diagnosed with fibromyalgia also meet criteria to be diagnosed with chronic fatigue syndrome. And so both conditions are related in the way how pain signals are processed through the brain.
Are you ready for the next slide?
I just wanted to mention something else. Fibromyalgia is absolutely real pain. This is not psychological pain. This is not made up pain. Yes, please, next slide. Okay, so we should talk about fibromyalgia is diagnosed. So diagnosed is based on clinical presentation, which means patient history and physical exam. So what the patient is telling me, the pain, how they are describing it, and also what I'm finding when I examine the patient is important. The most common symptoms for fibromyalgia are widespread pain, fatigue, poor sleep. Even if they sleep for 9 hours, they don't feel rested after they wake up, and cognitive issues. Many patients with fibromyalgia tell me that they cannot focus, or it's hard to come up with a right word when they're talking to someone, so they get frustrated with those cognitive issues. Fibromyalgia also has other symptoms, and it could be joint pain, stiffness, muscle spasms, back pain, pelvic pain, frequent urination, depression, anxiety, sensitivity to light, odors, and just sounds.
That's a lot of symptoms.
Yes, and there are other symptoms as well, but those are the most common that I hear from day to day in practice.
And then what
Now,
are the criteria for diagnosis?
okay, so the American College of Rheumatologists came up with criteria for diagnosis of fibromyalgia. So we have an old criteria and a new criteria. So let's talk a little bit about history of the criteria of diagnosis. So in the 90s, the American College of Rheumatology came up with a diagnostic criteria based on tender points, which means that if we apply pressure on specific tender points of the patient's body, they would feel pain. So if the patient had 11 out of 18 tender points positive or painful, they will be diagnosed with fibromyalgia. But this criteria left out some patients that don't necessarily have a lot of tender points. For example, men tend to have more fatigue or cognitive issues than tender points. So it kind of was some exclusion criteria. The new criteria that the American College of Rheumatologists came up with in 2010 is a lot more inclusive, and I believe also it's more accurate to diagnose fibromyalgia. This criteria is based on widespread pain, fatigue, unrefreshed sleep, and cognitive issues. Next slide, please.
We've got a good question in our chat box, if I could throw it your way, Allison.
Sure.
Tina asks, fibromyalgia disrupt your sleep, or is it the pain that disrupts your sleep?
So it could be both, right? So fibromyalgia is characterized by unrestful sleep, but also when a patient is having pain from an underlying condition, such as rheumatoid arthritis, it could be osteoarthritis, that they have a specific joint that's really painful, or it could be lupus or many other conditions that can also wake you up from sleep. So I have patients that, let's say, have rheumatoid arthritis, but they don't have fibromyalgia. They can also wake up at night because of the pain of the underlying condition or the arthritis.
Right. Now, myths of fibromyalgia. It wasn't too long ago. I remember PCPs and other medical practitioners would say to patients, hey, look, this is in your head. This isn't real. Run it off. Get tough.
Absolutely. So, it is interesting to know that the American College of Rheumatologists came with a diagnosis criteria in 1990. So I wonder, what did we do with our patients that presented the symptoms of fibromyalgia before? Maybe we were just telling them, well, I'm sorry, I don't know how to help you. Here's some medication. Try it and see if it works and if it helps you. So the pain of fibromyalgia is definitely not in their head. But the patients come and tell me, my family members or my friends tell me, you look fine. What is wrong with you? Why do you always complain of pain? So I think that we need to do a better job in educating not only patients, but also the general public into what entails to have fibromyalgia pain. The pain of fibromyalgia is real and affects the quality of life of patients day in and day out. And so it is important to know that sometimes fibromyalgia pain is brought on by stress. So if we can identify the stressors, maybe we can help our patients manage their pain. For example, a stressful situation could be, is a patient having stress at work? Or is there a relationship that is causing the pain? So although we can't make our family members disappear that are causing the stress, we could try and help the patient identify that situation. So maybe they could spend less time with that person, or see what can be done about their job if that's what is causing the stress.
Now, what do you mean by wastebasket diagnosis?
Okay, so when patients have pain, they tend to seek help, which is great. So they come to the healthcare provider and they said, so I'm having this pain and I have had so many blood tests and I have had a lot of imaging, extensive x-rays and MRIs, and everything has come back normal and everything is negative. So I must have fibromyalgia. This may be it. So it is not a consideration until the patient feels that everything has been checked and everything is normal, which is not true. Now we have criteria diagnosis that we can actually diagnose patients confidently with fibromyalgia so that they don't have to feel like, well, nothing else is wrong with me, so I must have fibromyalgia. Okay.
And is it a disease of women, or do men get it?
So fibromyalgia affects women more than men. About 80% of patients diagnosed with fibromyalgia are women. Some resources say between 70 and 90%, but we also know now that men get fibromyalgia. Granted, they don't present exactly with the same symptoms, but fibromyalgia also is diagnosed in men. The usual age of diagnosis is between 30 to 55 years old, but I absolutely have patients that have been diagnosed with fibromyalgia earlier, younger, or a bit older. Yep.
And then when folks say, look, I don't think you can do anything for me, nothing helps fibromyalgia.
So because the pain of fatigue, poor sleep, or fibromyalgia is chronic, I know that some patients can feel frustrated about it, and with due reason, because they've tried so many things and it seems like nothing is working. So what I like patients to know is that unfortunately there is not one thing that will help fibromyalgia. We have to try different things, and sometimes in combination that can help, such as massage, heat, maybe supplements, medications, all those things can help fibromyalgia. And so we'll talk more about that in the next slide.
And then what about how you treat fibromyalgia?
So before I go into treatment, I'm just going to talk about really fast about physical activity from the last slide. So a lot of patients feel that physical activity makes the pain worse. And the reason why they feel that is because when they exercise, when they have a good day and tend to go out and walk or jog, then the very next day or two, they're down, they're just in bed. So that's why the perception of physical activity making fibromyalgia pain worse comes. But I want to encourage patients to start nice and slow. Start maybe with stretching or Tai Chi, yoga, and then build from that. They could start with 5, maybe 10 minutes, and then 15, 20 minutes. So the key is to go gradually. And fibromyalgia pain is absolutely real. This is not a psychological diagnosis. Okay, so let's talk about how we treat fibromyalgia. Patient education is key. I am a firm believer that the more a patient knows, the better outcome in their health that they will have. So it is important to be able to refer patients to websites, books. I want the patient to understand their pain because the more they know, the more they can come and tell me so I can try and help. And also, like we talked about before, it is important to identify stressors because stress will definitely make fibromyalgia pain worse. Then we go to lifestyle changes, which is, I think this is my favorite part. It is important to know that a healthy diet, healthy nutrition, and physical activity, starting nice and slow, can help fibromyalgia. So I would encourage our viewers to review previous GPA sessions about yoga, meditation, and exercise. They're excellent. Also, there is a nutrition session that is absolutely great, and I learned a lot. So I think those will be helpful for patients as well. I also discussed a multidisciplinary approach in treating my fibromyalgia. So again, there is not one thing, one pill that will make the pain better. It is important to know that patients could benefit from physical therapy, acupuncture, biofeedback, massage, medications, and supplements. And then we also use medications to treat fibromyalgia. And some of the medications we have seen that helps patients is antidepressants. Why? Because antidepressants balance serotonin in the brain. Serotonin is a feel-good chemical that we have in our brain. So we can use medications such as Cymbalta, amitriptyline, and Effexor. Anticonvulsants such as gabapentin, Lyrica, and Savella can help with nerve pain. Savella actually also helps with fatigue.
And what about supplements?
So supplements are great. Ron, we treat patients that don't only have fibromyalgia, but underlying conditions such as rheumatoid arthritis, lupus, or other autoimmune diseases. So the goal is to try and decrease the pain, whether it be from fibromyalgia or from the underlying condition. So we have supplements that can help with inflammation, such as turmeric, cosamine, boswellia. Also, curcumin tends to help arthritis pain. So I encourage patients that if they would like to try a supplement, to view the GPA session from July 11th that Dr. Pinkston and Dr. Wickersham presented. It is an excellent resource on when to start with supplements.
Yeah, we've started using turmeric in a lot of the food we eat.
Well, that's perfect. It'll help with inflammation for sure.
And then when you get to support, where do you find support as a fibromyalgia patient?
So support is so essential in successfully treating fibromyalgia. Patients, are going to need a lot of support from their healthcare provider. So I encourage patients to find a healthcare provider that will listen to them, that will work with them, and will help them walk through the pain and not get frustrated when something has been tried and then it hasn't worked. Also, family member support or a friend support is really important. Sometimes a patient will tell me, my family doesn't believe I have fibromyalgia. So what I do is I invite the patient to bring either a friend or a family member with them to the visit, so that we can talk about fibromyalgia, and so they can listen and realize that it's not that they don't want to get up and just have a great day and enjoy their children. It's just that they cannot because of the severe fatigue and pain. Thank you, Ron, for the slide. I listed this slide for patient resources because, like I said, I think that it is essential that patients just know about fibromyalgia and their condition. I think that the more you know about it, the better you'll understand what you're going through. If you look at the very last resource, there's a Mayo Clinic Guide to Fibromyalgia book that you can go online and perhaps see the printable version of the book. But Mayo Clinic has their own fibromyalgia clinic, which offers a lot of resources for patients that have fibromyalgia, and even some dietary choices that they can try and see if it helps with pain.
Well, that's really perfect. Now, folks, if you don't get a chance to write those down, you can go back and look at this GPA Live later and stop on that slide and write down the resources. Dr. Polson, that was fabulous. Is there anything else you wanted to add that we didn't ask you?
I just want to encourage patients not to give up. I know that they have good days and bad days, and it's really easy to feel bad on the bad days. I know that fibromyalgia can lead to depression and anxiety. So I just want them to know that they are warriors and that they can go through the pain and that they can come to us for help. And we will always be willing to help, and we will not give up.
Folks want to call you, the number's on the screen, 210-477-2626. Dr. Polson, you were great. Thank you. We really appreciate you coming on board, and I hope we get a chance to talk with you again in the near future. Have a great day.
Thank you for having me, Ron. It's been a pleasure.
Absolutely. Bye-bye.
Bye-bye.
We're going to turn now to Dr. Susan Blackwood, who will rejoin us. She was here at the beginning of this GPA Live, and we're going to bring her back to talk about how to get involved with the Global Pain Association. Susan, how do we get involved?
Before I do that, I want to thank Dr. Polson. That was an amazing presentation. She serves on our advisory committee and also does her daughter, Grace. And Grace has been helping us with our support groups on that first and third Tuesdays. And so we hope people will tune in for the support group with Dr. Marianne Pinkston. And of course, getting involved Global Pain Association is really important to the growth of our organization and how many people that we can serve with our resources. So they can get on our globalpain.org website. There's a location for them to donate or be a supporter. We also want them to sign up for our newsletter, which is not really, well, it's a newsletter. And then there's a weekly reminder of what event is going to be happening on Global Pain Live that next Saturday. So we really encourage them to stay in tune with us, stay in touch with us, share the things that we're doing each Saturday with people that they love and care about. And that's what's going to keep the organization going. We're going to be still around 10, 20, 30 years from now. We might have a new moderator. We might have a new volunteer president. But certainly we're going to have an organization that's going to continue to help people if we can get the support that we need to stay important as an organization. And speaking of important as an organization, there might be some of our viewers today that would like to win, we like winners, win one of the Global Pain Association beautiful teal shirts and a $10 gift card from our friends at HEB. So if they'll get on the private messaging on our Global Pain Facebook page, send us their name, their address. We need a physical address so I can send the shirts to them, and what size shirt that they would want, medium, large, or extra large. We'll get those out to them. And we're going to take the first 3 winners today that get their information to us. So thank you for watching, appreciating what Global Pain does, and all of our sponsors have been really important to us.
Thank you, Susan. Dr. Susan Blackwood, Global Pain Association Executive Director. And if you want to win that t-shirt, go to the Global Pain Association Facebook page, click on message, and let us have your name and address, and the first 3 will win the t-shirt and the HEB gift card. Next Saturday, March 6th at noon, right here on GPA Live, our topic is opioid abuse, how it happens, and what to do with it, how to control it, how to get help. Dr. Marianne Pinkston will be our presenter. And if you have questions you want to ask, email those to info@globalpain.org. Thank you all for joining us. I'm Ron Aaron Eisenberg. Thank you to our executive producer, Gina Galaviz Eisenberg, and to all the board members at GPA Live and at the Global Pain Association. We'll see you next week right here on GPA Live. Have a COVID-free weekend, everybody.